Norethisterone is a synthetic progesterone used to treat a variety of menstrual and reproductive health issues, including heavy or irregular menstrual periods, endometriosis, and premenstrual syndrome (PMS). It can also be used as a contraceptive and to delay periods for specific occasions. Norethisterone works by mimicking the effects of the natural hormone progesterone, regulating the growth and shedding of the uterine lining. It is typically taken orally in tablet form, with the dosage and duration of treatment depending on the specific condition being treated. For menstrual regulation or period delay, it is often taken once daily, starting a few days before the expected period. Common side effects of norethisterone include nausea, headache, breast tenderness, and changes in menstrual flow. These side effects are generally mild and temporary, but if they persist or become bothersome, patients should consult their healthcare provider. More serious side effects, though rare, can include signs of blood clots, such as sudden severe headache, chest pain, shortness of breath, or leg swelling, which require immediate medical attention. Patients should inform their healthcare provider about their full medical history, especially any history of blood clots, liver disease, breast cancer, or unexplained vaginal bleeding, as these conditions may affect the suitability of norethisterone. It is also important to disclose all other medications being taken, including over-the-counter drugs and supplements, to avoid potential interactions.